The items we have to comment when approaching any ECG for rhythm assessment are heart rhythm, which is the R to R interval, the heart rate, the P wave and P to P interval, B to QRS ratio, PR interval, and the QRS complex, and we essentially have to look for any hidden non-conductive B waves. First of all, I'd like to remind you what's meant by normal sinus rhythm. This means that every P wave is followed by one QRS complex. There is equal numbers of P and the QRS complexes. After that, we examine the P wave in different leads. We find that in every lead has a specific P wave morphology, and the axis of P wave here is positive in all leads, negative in AVR, and biphasic in V1. This is normal. And finally, the heart rate falls between 60 and 100 beats per minute. Back to our example. Here you can appreciate that the distance between every two consecutive R complexes is fixed, and this translates to regular rhythm. After that, we know that calculation of the heart rate in regular rhythms needs to divide 300 by the number of large complexes. Here, 7 large complexes between every two consecutive R complexes, and the heart rate here is 43 beats per minute. So this is an example for regular bradycardia, and we have a specific algorithm to approach ECG with bradycardia. After that, we have to comment on the P wave, and here the P wave is of sinus morphology. We have an example here, lead 2, which is positive, and P wave is symmetrical, and its width and amplitude is less than 2.5 small squares, which means this is a sinus P wave. After that, we examine the P to B interval. Here, the P to B interval is fixed, which means it is regular atrial activity. After that, we examine the B to QRS ratio, and here every P wave is followed by its QRS complex. Okay, the ratio is 1 to 1. But we have specifically in bradycardias, we have to look for hidden non-conducted B waves. How is that done? We divide the distance between any two consecutive P waves and take the point in the middle and see if this point points to any hidden P or not. If there is a hidden P, it will be in this midpoint between two P waves, but here there is no P wave in the middle. Here also. So we do this in all the ECG to exclude any hidden non-conducted B waves, and in this example we don't have any non-conducted hidden B waves. After that, we remind you of the normal PR interval. The normal PR interval starts from the beginning of the P wave to the beginning of the QRS complex. It represents time between atrial depolarization and just before the first ventricular cell depolarization. It should be fixed along the whole ECG, and it's normally 3 to 5 small squares. In our example, yes, the PR interval here is fixed all through the ECG, and it's normal 3.5 small squares. Finally, the QRS complex here is narrow, less than 2.5 small squares. Note that the QRS complex is not essentially always narrow in sinus bradycardia. It could be prolonged due to other causes, but the main items that we depend on to diagnose sinus bradycardia are being fixed R to R interval, which means the heart rhythm here is regular, the fixed B to B interval, and the fixed PR interval. And the most important thing is to look for non-conducted B waves, and in sinus bradycardia we don't have any non-conducted B waves, unlike, for example, Mobitz 2.